I'm Natalie Kunsman, MD, and with over 24 years of experience, I realize that I have to have you step into my living room so that we can have a discussion about a condition that affects boys, girls, women, and men, and you. We're talking about ADD or ADHD, attention deficit disorder, attention deficit hyperactivity disorder. And it's affecting now 4 to 9% of American children based upon which studies you read, and potentially 5% globally. So globally, it's also on the rise. Now, interestingly, there is a low prevalence in Sweden, Italy, Australia, and Iceland, and a very low percentage in France of about 0.5%. Now, there have been some Ukrainian children's studies. So there was a sampling of about 600 kids living within 30 kilometers of Chernobyl, and it's up to almost 19.8% in that cohort. So there may be some environmental issues versus psychosocial issues related to living in a disaster area. So as I said, cases are on the rise. And it's not that we're changing our diagnostic criteria, but kids and adults are meeting the criteria more now than ever. So ADHD is primarily a disorder of self-regulation. These people are not stupid and they're not forgetful, but they have difficulty concentrating, trouble controlling impulses, and they may have excessive activity. There is an inattentiveness, so that they sometimes get labeled as a space cadet or ditzy. They may be hyperactive and impulsive, or there may be a combination of all of those. So we would like to also be mindful that it is difficult to diagnose this condition under the age of 5. So there may be some overdiagnosing in that age bracket. And I think we're all aware of the hyperkinetic, energetic, intrusive nature of toddlers. So of the risk factors, there are biologic risk factors, social risk factors, and environmental risk factors. Now, biologically, the brain of an attention deficit patient is smaller. The connectivity is less, and dopamine is lower. Now, there's also some decreased blood flow to certain prefrontal areas that we can measure on SPECT examinations. So a decrease in blood flow will indicate that there is decreased brain activity. So the prefrontal area of the brain will house the executive functions, and they are responsible for things such as planning, organizing, paying attention, remembering, and actually emotional reactions as well. Another interesting finding was that the amygdala and the hippocampus are smaller in the brains of people with ADHD. And these areas are responsible for emotional processing and the impulsivity. Now, one case study found that the children with ADHD do not have the same connections between the frontal cortex of the brain and the visual processing areas. There also seems to be some connections between asthma, seizure disorder, gluten insensitivity, and what I will just classify as inflammatory states. Now, environmentally, or the epigenetic influence, the environmental associations are being researched with mothers' stress, smoking, lead exposure in utero, and low birth weight. Socially, a low family income, low father's education, a sudden life change, or the diagnosis may vary based upon the culture from where you came. In general, children do better outdoors than indoors, and now kids are having up to 7.5 hours a day on media and electronics. Now, French psychiatrists, and if you can recall in the beginning, France has a low percentage of 0.5%. So the French psychiatrists believe that there is an association between some preservatives, allergens, and they also believe that some things have gone awry in the social context of the child and the root cause. So the ADHD child was worse with the food dyes. And interestingly, French children don't snack. They eat 4 times per day throughout the day in a structured eating situation with the parents setting limits. And even babies will cry it out if they don't sleep through the night. So keeping in mind also that ADHD can have what we call comorbid conditions. So you can have a person who has ADHD as well as depression or anxiety, insomnia, bipolar disorder, learning disabilities, traumatic brain injuries, drug and alcohol addiction, personality disorders, and legal and interpersonal problems. So let's get to it. What is the treatment of ADD? Well, there are many, and there can be an integrative approach, which is my style of management. So if you can remember last week's lecture, we still need to stay away from the neuroexcitotoxins. So ADHD children and adults traditionally should stay away from gluten, sugar, dyes, nitrates, soy, aspartame, and of course this list is not complete. And in America, our traditional dairy sources, mostly because of the intolerance to casein 1. So we need to check people's food allergies before prescribing any dietary changes. But within the dietary context, fish oils, in particular DHA, and probiotics are very helpful. And there's some herbal extracts which are gaining some research, such as Bacopa. The key neurotransmitters for ADHD are dopamine and noradrenaline. And in the ADHD brain, there is a dysregulation of the dopamine system. For example, there is either too little dopamine, not enough receptors for it, or the dopamine is being used inefficiently. Now, stimulant medication is to help the ADHD so that we can keep dopamine either optimally producing or to keep dopamine in the synapses longer. So the common medications that we all know are Ritalin, Concerta, Adderall, or there are variations of them. And there is an SNRI, which is working on norepinephrine, which is Strattera. Caffeine does a decent job when we don't need a strong bullet for a less severe case. And with these medications, the hope is always with neuroplasticity, the brain can pick up where the medication left off, but I'm seeing that less often than I would really like to see. Behavior modification must be paired with medications. So there is help in having an accountability partner. So that may be for adults to help keep the adults on track or to continue some of the therapeutic recommendations. And that can be worked with in conjunction with your therapist. For children and adults, technology, which incorporates calendars, reminders, timers for homework and studying strategies, are very beneficial. And there's no medication involved with that. Developing scheduling and planning systems is key in management. There is research on meditation and yoga, which will help improve focus, which are the tenets and the principles of those practices. Sound therapy. Now, this is in an effort to train the brain to listen better when the brain has some auditory processing difficulties, certainly with speech and language. There is a style of therapy, including interactive metronome, and that is from Michigan University, and that may include some tapping or clapping or rhythmic beats to increase the focus and weed out distractions. Neurofeedback is also a therapy that can take those theta waves that are more pronounced in the ADHD brain, and theta waves are the creative or daydreamy waveforms in our brain that are in excessive amounts. And the neurofeedback therapy is to try to convert them over into more beta therapy, which are our alert brain waveforms. We also want to help work with the working memory. And a lot of times that is in a video game format, which also is in an effort to get rid of medication or prevent the use of it. So that also improves the attention, cognitive flexibility, and self-regulation. Back to dietary issues. The low inflammatory, high fish oil, good meats, high vegetation, no processed, no aspartame approach needs to keep the brain quiet rather than on fire. And a lot of our heavy grain-based old school food pyramid is not beneficial to a brain that is trying to attend and to focus. Sleep is also imperative to repair and to allow that growth hormone secretion at nighttime. And again, especially in a child's brain that is developing, we need that to help develop some of these neural pathways that are not quite so functional in the ADHD brain. So I know this was a brief overview, but I would say if you believe that you are manifesting symptoms of ADHD, insist on taking an integrative approach to take action steps, to involve several professionals to work on ADD, and to round out the body's optimization to help the brain's optimization to be able to learn and focus. There is help even in the school systems for the children, since learning is the focus of growing up as a youngster. I will entertain any questions you may have about this topic. There are so many people affected, so please share to those that you think may be warranting this discussion and aiding more help in just the medication approach. Please like my channel. You may subscribe. We will have many more discussions on these topics. And until we meet again, be well.